Hello, everybody. As we all know, October is a breast cancer and mental health awareness month. And breast cancer is a battle fought not only in the body, but also in the mind. While treatment targets the tumor, the emotional toil often goes unseen. Hidden beneath smiles, behind brave faces, and within silent struggles, the Brain and Sleep Medical Center spotlights the emotional and then the psychological impact of breast cancer, focusing on depression to raise awareness and also break the stigma, and then also promote holistic mental health. So for many facing breast cancer, it is heavy comparison, and we need a companion. One that lingers long after the diagnosis, during treatment, and even its recovery. In this episode, we will explore the emotional journey behind breast cancer, the fear, the isolation, the strength, and the hope. We'll all hear stories of resilience, examine the science behind it with these fine doctors, and also the body connection, and shine light on the importance of mental health support. Because healing is more than just physical. It is time that we talk about the mental health aspects of breast cancer. In our midst, we have very renowned doctors. We have Dr. Abishai Anlima. Dr. Abishai is a licensed consultant clinical psychologist who works with a Kolebu Teaching Hospital, and also a tutor, a lecturer at the Mental Health Institute, Sanford Hospital. And he also consults for Brain and Sleep Medical Center. He addresses diverse mental health conditions and personal development needs. As a committed advocate for African-centered scientific value and Pan-Africanism, he is an editor for the UK's National Institute for Health and Care Research and has mentored many students at the University of Ghana, University of Professional Studies, and Ghana Christian University College. His work is driven by a passion to deliver ethical, scientific, and impactful psychological interventions, especially for the vulnerable group. Dr. Abishai.
Hi.
You're welcome.
Thank you very much.
Okay, so we also have Dr. Barbara Bachman, who is a specialist psychiatric at the Kolebu Teaching Hospital, and she's been involved in mental health affairs for the past 4 years. She's passionate about women, mental health issues, and currently in a senior residency program at the Ghana College of Physicians and Surgeons and the West Africa College of Physicians. Dr. Barbara, Dr. BB, Dr. BB, you're welcome. You can see all of us in the pink. And then on Zoom, we have Miss Juliet Mills Lutrut, who is a mother, a wife, a philanthropist, and the director of the House of Jewels, comprising of Jewels Collection, GJ by Jewels, Jewels Hair Collection, Jewels Magnetic Lashes, and Jana by Jewels, all of which pour a portion of its profits into Pink for Africa. Striving for success is a given, but impacting the world is her greatest desire, as evident by her products and services. After surviving breast cancer, this industrious personality has redefined innovation and ambition to keep raising the bar as a self-made successful businesswoman. She's an entrepreneur whose inauguration of her brand name has changed how the world reckons the act of survival. Juliet is in her 17th year of remission from cancer. She believes her journey is to continue helping and bringing awareness of breast cancer with financial support to the women of Africa, Pink for Africa, a foundation that was set up to raise breast cancer awareness. Would you be alive today? After pondering over that question for a while, Juliet realized that the one difference she had was that she lived in America, where her chances of surviving breast cancer were higher than that of others or other African women very similar to herself and younger women who did not have the same advantage as she has had. To date, Pink for Africa has helped raise breast cancer awareness among approximately 855,000 women across the country. The foundation stresses the importance of early detection and creates public awareness of risk factors, symptoms, diagnosis, treatment, and support systems while decreasing the stigma attached to this disease and the need for positive attitude. So Miss Juliet remains very passionate about using her experience to counsel other women with or without breast cancer to help them prevent or fight the disease. This is a wonderful woman. Hello, Miss Juliet.
Hello, everybody. How are you?
Hi, we are doing extremely well, and we are happy to have you.
Thank you. Thanks for having me.
So, Miss Juliet, who is a survivor of breast cancer, and she's doing extremely well in her field, very industrious. How have you coped with the breast cancer? How did you cope with it in terms of your mental health when you heard that you had cancer, when you were diagnosed for the first time?
You know, I think that every individual is different, and I think that the journey is so vast depending on the kind of support you have around you. But of course, as a human being, when you hear the word cancer, I don't care who you are, it's going to shake you a little bit, especially to the core of you. So I remember totally going numb, and I don't remember anything the doctor said after that word cancer. It didn't register anymore. But dealing with it in terms of family dynamics, my children were very young. I had just turned 40 when I was diagnosed, so I was fairly young and had 3 boys who were also young and in school. And the reflection of what if I'm not here, what if I don't make it, what if this cancer is not treatable, what if it reoccurs, how am I going to do with surgery, there's a lot that plays on that can really mess with your mental stability and just anxiety all through the journey.
Wow. So, Dr. Anlima, listening to Miss Juliet, for any patient to hear for the first time to have been diagnosed with breast cancer, what, per your experience as a clinical psychologist, what are some of the things that the person goes through? Just as, Miss Juliet said, if you have any addition.
Yes, so we call something the grief response cycle.
Okay.
They go through grief. Grief comes in when you now realize you've lost something. So the first thing most of them go through is, as she said, she went numb.
Yeah.
So the moment she had cancer, that was where everything ended.
Yeah.
There are many things the doctor mentioned, she couldn't think about it. So people begin to think about what you said. They begin to wonder, is this really true? So they go through fear, doubt, anger, and the anger is directed towards themselves. Others, it is towards either their children, their spouse, or people who are subordinates to them. Now, having gone through all these, they now begin to wonder, am I going to survive? Will I have the money to be able to go through it? What about the strength? How will I be able to keep moving? So all these become experiences for them. And then when the reality hits them so hard, depression sets in.
So it means mental health is very important dealing with any cancer or any cancerous, any part of the body.
In fact, it plays a very key role when it comes to the treatment, the diagnosis, the treatment, and even the after effect of treatment as well.
Okay. Dr. Bibi, so before a patient, before a news is broken to a patient about, let's say, cancer, does the patient go through any mental health counseling or any talk before it is given, that news is broken?
Well, in my practice, I haven't really heard that happening. Usually, they get the results of your scan or things you've done, images you've taken, and the doctor calls you to a room and starts to sort of massage the information a bit and finds a nice way to break the news to you. Nobody really prepares you for that diagnosis that you have cancer, as she mentioned earlier. And in my personal experience, I know someone who noticed a lump in her breast, and she just called me that she's noticed a lump. I said, go and do, what's that thing called? When images. And mammogram. Thank you. So when she did it, the results was there. There's a breast cancer. She had a lump, but had to be biopsied.
Okay.
They will know what kind of cancer it is.
Right.
Now back to breaking the news.
Right.
Now I am a doctor. I'm a relative. So
how
do I do that? You understand? So I had to talk to a friend psychologist to come in and try to bring down the tempers a bit before the news is finally broken to the person. Even when that's taking it wasn't easy.
Yeah. Miss Juliet, do you think that if you had gone through some counseling before the news was broken to you, there would have been any difference in your reaction?
I was offered counseling. I just had an amazing family support, so I didn't lean on that counseling. But, counseling can be in so many different ways, from the diagnosis period when you receive the news to post-surgery, to post-treatment, to recovery. All of it has different emotional traumas that you go through and fears you go through all through that journey. So, psycho-oncology is so important, is what we call it here. It is so important to really make sure that the patient knows exactly what they're about to go through, and knowledge is passed on from the doctors. Our culture is in such a way that a lot of doctors hold back from telling the patient exactly what the process will be. Where in the US, doctors are an open book and they tell you exactly what you're going to go through, so that consciously and subconsciously you deal with it and have tools to support you. Our culture, we frown on different things. So we're dealing with two different kind of experiences in terms of mental health and how this affects this particular disease. So it's really interesting to say exactly what is best for our culture and what is best for here. But I know that learning about what my journey was about to be was important to me. I needed to know exactly, okay, so you're diagnosed, now you're going to go through biopsy, then you're going to go through, so that I can prepare my body, mind, spirit, everything to be ready for each step of the way. And so, again, working with Think for Africa and working with the different hospitals, I noticed that doctors hold back, not because they don't want to share the information, because patients are traumatized when they are very vivid with exactly what is going to happen to them.
Well,
am I wrong, Doc? Please share.
yeah. So exactly the question, you have hit right on the nail. I wanted to know, immediately the news was broken I mean, how you even be able to tell that this person is going through or would go through depression, you know? So from her experience and from her foundation, people's experiences that they have shared, she happens to say that throughout the journey, yes, you need a psychologist, you need counseling, but at what point does depression set in, doctor?
Okay, so when you look at the stages of grief, you realize that the first time the news is broken, the person is going through doubts. Is this reality? Is this true? Then, when the reality hits upon them, that's when depression sets in, because they tend to realize that they can't reverse it. They have to live with it, and now fear also comes in. Am I going to die? How would people respond? How would they react when they see me? There was a study that was done, and the study was to look at the two most feared words in the dictionary.
Okay.
And you realize that the first one is cancer, second one is terrorism. So we go to the US, I think it was done in the US.
Right.
So people go through all these things, and it begins to put them through stages of depression.
Depression. What are some of the symptoms, Dr. Bibi?
To add to what Doc mentioned earlier, depression is the layman term of depression is not the clinical depression.
Okay.
Clinical depression is you've had low mood consistently for more than 3 days in a week, which is very bad in the mornings and gets better when you wake up.
Low moods, like
low
you
moods.
get up and then the energy is so low.
Exactly. You
Okay.
have so you had all those things lasting for about 2 or more weeks.
Okay.
So that's when
Continuously.
Okay. Yes. So that is when we put in the depression. But we tend to use depression and sadness like loosely. But depression is like a big thing.
Okay.
And so to the symptoms of depression, so then the low mood, then loss of pleasure, like you used to like watching television, now you don't have
Right.
the zeal to watch
Right.
anymore.
Right.
Your sleep is disturbed, you're not eating well, you feel tired all the time, you cannot concentrate. But we should bear in mind that the treatment for the cancer itself, the side effect of some chemotherapy can mimic the depressive symptoms.
Okay.
So in that case, we use clinical judgments and other skills to say that this person has depression whilst having cancer as well.
Is it prevalent?
So when it comes to this breast cancer, studies show that 1 in 8 women will suffer it at some point in their life. When it comes to depression, 1 in 8 women
will
yes,
suffer breast cancer.
yes, at some
Okay.
point in their lives.
Okay.
That's what the research is
study.
showing
Okay.
from the WHO.
Okay.
And then when it comes to depression, we are realizing currently from research that about 30% of women living with breast cancer end up having clinical forms of depression, which means they are going through severe forms of depression. The reason that depression works in stages. We have those who are going through normal depression, mild depression, moderate, then the severe ones, even those with extremely severe ones comes in.
So at what point would you determine, or any person diagnosed with cancer has to go through some counseling, as she said, and at what point would you know that the person is depressed?
So as Madam Juliet said,
Yeah.
it doesn't matter whom you are.
Right.
The moment you hear, oh, it's unfortunate, I have to let you know this, but you have, then the cancer or the K word, as we often see, begins, then your heart begins to race. So the moment this diagnosis comes in, they go through some moments of mood turbulence, as Dr. Barbara was trying to help us realize. Now, we come in to say that they are going through clinical depression, and that comes in with some clinical judgment, as you said, because even some of the side effects of the chemotherapy, radiotherapy, some have to go through lumpectomy, mastectomy, and the others. So you realize that they are going through some particular effects which might not be clinical depression. We have skills we use, and we have the observations we also go through. Okay. So we could look at their cognitive framework, their emotional framework, their behavioral and physical. So you tend to realize that some of them They are always sad, they are always fearful, they can't sleep at night, insomnia is coming in, the appetite becomes a problem, they're having changes in their weight, they lose concentration, and all these things begin to show that some even begin to withdraw from friends and society. And we can tell that this breast cancer is having a deeper tone on them. Therefore, they require professional
So, but
help.
how does it manifest? How does the depression manifest in a breast cancer patient, doctor?
So it's just like normal depression. It's not like they have a special form of depression. It's the ability to pick it up early and treat it alongside the cancer treatment they are going through.
Okay.
So with that, as Doc mentioned, there are skills that we use.
Okay.
So if we should employ those skills routinely when they go for checkups and stuff like that in their management, we'll pick them up. So there's this skill, PHQ9, has 9 items.
Okay.
About 5 minutes, you finish it. Assesses the mood.
It's a depressive skill.
Yes, assesses the mood, general mood. So when you score above a particular number, then you are picked out and then you are deemed to be having a higher risk of having depression. Yes,
Okay.
so it's just by screening.
Okay. Miss Juliet,
Yes.
so at the beginning stages of your diagnosis, did you have any severe or moderate depression as per the doctors, what they are saying?
You know, that's why I think that it is such a patient-by-patient case.
Okay.
In my situation, I'm somebody who always looks at the glass half full, not half empty.
Positive.
So I approach this knowing that education is power. The more I know about the disease, the more I understood what it was.
Right.
It made me know that, okay, I was diagnosed stage 1. I needed to go through this. I needed to move through this and that. So I became my own advocacy. I didn't depend on the doctors to tell me everything. I started reading up and learning about what are some of the things I could do. I knew my mental state was very, very important because I had children.
Yes.
And I needed to be sure that I needed to stay positive because if I show fear, then my whole family will crumble.
Yeah.
So it was important. So I think I didn't even allow it to linger. It popped in my head a few times. I remember a couple of episodes where I opened my front door and told whatever energy was in my spirit that day that made me feel sad to get out of my house, and I attacked the door. For me, it was an act that I needed to do to take charge of
Your
my space and to make
Exactly.
sure that I was in a good mental space. So I think that yes, but I think that some of the things we can do in our communities is to advocate more like we're doing.
Miss Juliet, we'll talk about the advocacy. That we'll talk about the advocacy. You just hold your breath. We'll talk about the advocacy, okay? I'm enjoying the storyline though, and I love your positivity or positivism. Which of them? You should have a positive mindset. You know, Miss Juliet is telling us when she was diagnosed, I think that in general you are an optimistic person, right?
Absolutely.
Yeah. So we should learn to be.
Again, it's also through education. The more my doctor opened up and shared with me and told me you will be okay, I got you, really helped me know that.
So I think the health system should also educate the health providers how you break the news, how you are able to encourage the people so that they don't go home even with more mentally ill. You know that. Anyway, so we'll go on a quick break, and when we come back, we'll talk about the advocacy, and I'm pretty sure that Miss Juliet has a lot to tell us about the advocacy, and our doctors also have a lot to tell us about the advocacy. Don't go anywhere, just stay tuned.
Welcome to the Brain and Sleep Medical Center, a haven for mental wellness, emotional well-being, and healthy sleep. Our peaceful environment fosters healing and renewal. Proudly serve institutions such as the Bank of Ghana, Ghana Port and Harbors Authority, and the Judicial Service. We also consult at IMA, Duracare, and partner with the Trust Hospital. We manage sleep disorders through our state-of-the-art sleep lab, provide mental health care.
Greetings to all. My name is Dr. Yan Fojo. I'm the CEO and the founder of the Brain and Sleep Medical Center, currently located at Aboko. We started our journey from Community 10 in Tema about 14 years ago, and since then we have grown exponentially, covering all aspects of mental health.
In partnership with organizations like Pink for Africa.
I am Patience Asamoah, the General Manager at the Brain and Sleep Medical Center. We are committed to excellence in both care and service. Our multidisciplinary team works around the clock to ensure every client receives personalized support, whether it's for mental health, sleep therapy, or addiction
For
recovery.
help anytime, call our 247 crisis.
BBSMC, the Premium Private Mental Health and Sleep Medicine Facility in Ghana.
We welcome back. We are in Pink October. As we all know, we are dealing with depression and breast cancer. October is the month of breast cancer and mental health awareness. And we have here Dr. Anlima and Dr. Bibi, Dr. Bachman. And on Zoom, we have Miss Juliet Luttrell, who is a breast cancer survivor. Miss Juliet, are you still with us?
I am.
Okay, so we would want you to give us a short or brief background about how advocacy helped you in your journey.
Well, advocacy did not help me with my journey.
Okay.
My diagnosis ignited the birth of Pink for Africa, to be able to educate, my sisters, my aunties, my mothers, and a better understanding to the 1% of men in our world who also are diagnosed. To see how we can spread the word across Ghana and help our women with early detection. I think for me, it has allowed me to see closely what some of those concerns are. And I think that is part of why we are here today.
Right. So Pink for Africa is an NGO, right?
Yes, it is.
And is it in Ghana?
It is both in Ghana and in the US.
Okay. So your main aim, as we said, is to educate people on breast cancer. Did you have any stigma?
Well, we initially started with education, but we realized that education was not enough.
Okay.
So we partnered up with the first hospital being Kolibu, and started to raise money to help women pay for their surgeries, their chemo, their radiation, and also advise on diet and encourage people emotionally as best as we could. But we couldn't do that alone. As we grew as an organization, we've been here for 14 years. As we grew, we realized that the need to serve in different areas are very, very important. And that is where mental health also really came to the forefront of this journey.
Okay, so Miss Juliet, for how long did you battle with your breast cancer? With the breast cancer?
From diagnosis to treatment and the complete journey with surgery, about 2 years.
Oh, within 2 years.
But it never leaves you.
Okay.
It never leaves you. Let me tell you why.
Okay.
A year and a half, 2 years ago,
Right.
my 10-year for my reconstruction was due. I went to reconstruct, to remove it and replace. 9 months into it, I got a call that there's a recall on the implant. So I went back, went through another surgery, and had it removed and replaced. Then a year later, I needed to go into surgery again. So it never leaves you. It's something that you're going to remember with your scars. You're going to. It changes you. To me, it changes you to a better human being because it allows you to eat better, to take better care of yourself, to appreciate life a little bit more, and to understand that you're no different from anybody else. We're all human beings, and this happens.
So, from diagnosis to the surgery, treatment, and everything, 2 years, and afterwards has been how many years now?
So I have been in remission for 17 years. Actually, no. From diagnosis to now, yes, it's been 17 years. This year will be my 17th year.
Great. Doctors, now that Miss Juliet has shared a little bit about her, what advice would you give to people who have not yet been diagnosed, to help them so that, we say early detection is the key, it saves life. So what advice would you give to the general public about early detection?
Okay, so maybe I would start.
Right.
As we learned earlier, that's about 1 in 8 women stand a chance of being diagnosed with breast cancer.
Okay.
This is very unfortunate, although some few men can also get breast cancer.
1%.
We are about 1%, but the majority rests on the shoulders of women.
Right.
So every woman should make it a point to always come for this screening. In October, it's for free. You come and you get a free test. But it shouldn't be about the women only. I believe the men should also encourage the women. Okay. So hold the hand of your wife, your mom, your girlfriend, your sister, bring them to the hospital, and let's do a marvelous job together this October.
Okay. Dr. Bibi?
So to add to what Doc mentioned, you can also do self-examination.
Okay.
Look in the mirror. Go on YouTube, there are videos on how to do it.
Okay.
And it's
I thought you were going to do some demonstration, but anyway.
I thought we were talking about depression.
No, but that brings the depression, so they work hand in hand. Okay.
Oh, they are. So, okay.
So you go on the YouTube.
You go on YouTube.
Okay.
There are so many. And as you said, October, many hospitals offer free screening, breast screening for that. And you should, if in an unfortunate situation that you get diagnosed, you should know that it's not the end of the world.
Right.
Just like how Miss Julia had a very positive outlook to life. You should try and see the positiveness in that diagnosis. Yes, and aim to seek treatment and go with it. And then also, you shouldn't be afraid to seek help when you're going through mental issues and you cannot handle it. Just seek help, have a strong support system, and you'll be good to go.
But the support system, you don't decide or you don't determine, because it's people around you.
Yes, but you can also choose the people around you. Some people who give you bad energy,
you get no.
Miss
Juliet, did you walk to the hospital to check your breast, or what happened before you were diagnosed with the breast cancer?
So in the US, when you turn 40, there's a routine check that you do as part of your physical yearly. So I went in for a routine mammogram, not knowing what was brewing. Breast was dense, so they couldn't see through the tissue. So they asked me to do an ultrasound. I did the ultrasound, they still couldn't see through it, and they asked me to do an MRI. So the MRI was what caught my tumor. It was very small, and it was in the left breast. So they needed to do a biopsy, and they needed to do an MRI-guided biopsy with me, because the MRI had caught it. It wasn't the human finger that had felt the lump. So through that, the diagnosis, once they tested the tumor, it came back that it was cancerous.
But before you went for the routine, everything was fine? You didn't feel any pain in your breast? Nothing?
Well, that is the interesting part of breast cancer in the early stages. there is no such thing. You're not going to, some people don't even feel a lump. Some people don't feel, that's why the screenings are so important. That's why the advocacy to screen is vital to every woman. Once you have breast, at the age of 13, you need to be taught how to self-examine and be taught how you learn about your body and your breast.
So at the age of 13, you should be taught how to self-examine your breast, right? Yes. And then at 40, you should do a mammogram.
At least on your birthday,
on your 40th birthday.
No, 40, 41, 40, every birthday.
The birthday where I have to celebrate things.
You just do a routine labs and add a mammogram to it.
Okay.
Yeah.
So after your birthday, maybe a day after your birthday, because the birthday is more for celebration, not for medical examination. I think we should be real, or yeah. So what are the stigma? What's the stigma behind all these breast cancer? People with breast cancer, do they go through any stigma in our society here?
Should I? Okay.
Yes, Dr. Baby.
So they do. They go through the self stigma, and then they go through the other type of stigma. So they are, as Doc was saying, they are asking themselves, why me? Why not the other person? What did I do to deserve this? You understand? So all those things, they are stigmatizing themselves. And then before other people to, in our culture, because of the education and then the awareness, people don't know much about cancer. Some people even think that cancer can be contagious. So these people,
they won't come
close to you. Exactly, right. Yes. And because of the whole, like for breast cancer, they're going to cut off your breast. You don't feel like you're a woman. That's stigma of not looking feminine enough. We keep the person away from
right.
enhancing treatment. Yeah.
Okay. All right. So, and how about, doctor? Are there stigma? Have you encountered anybody with stigma?
In fact, this very morning, before going to work, I had a chat with one. I call them warriors.
Okay.
Because to live with breast cancer, you must be a warrior. You must be resilient to keep the fight. So I had a chat with one warrior, and I also had a chat with one woman who also uses medicines from India, China, Israel to be able to. And the survivor was saying that she believes that maybe some spirits might have caused, because she doesn't know of any family member who has cancer, and now she is getting it. Even her daddy didn't have a prostate. Then I spoke to the healer, and she too said that, it takes about 2 months for her to be able to work with those with breast cancer. But if it's not caused by demons or evil spirits. So when it comes to the stigma, our society, we have this spiritual aspect where we are thinking that, what do people think of me? Some might think that I've done something bad against God. That's why I'm going through this. And that also becomes some form of a spiritual form of stigma people go through. And when that happens, not until that has been psychoanalyzed and removed, it becomes a huge blow onto their mental health.
So we have a charge to keep. We have a lot of work to do as health professionals, as advocates, NGOs, survivors. I think that the survivors will be the role model for people who are diagnosed, so that they know that there is hope, right? Am I right?
Absolutely. But because I was diagnosed in the US and treated in the US, the average Ghanaian woman does not connect with me. She connects with a local Ghanaian woman who lives in Ghana, who has been diagnosed in Ghana, and there is plenty of them. So what part of the encouragement is for women to speak up and not hide and not be afraid that it is okay. It is why I put my face on this disease, because I want my sisters, my mothers, my aunties to understand that it doesn't happen to you if you have big breasts, if you're from Sunyani or if you're from wherever. It doesn't matter. It happens to the lawyers, it happens to the market sellers, it happens to the attorneys, it happens to the kinky seller, it happens to everybody. It happens to the black, the white, the rich, the poor. It's not prejudice.
So every woman is at risk.
To not be shy of it.
Every woman is at risk, and we need to not to be afraid or not to be stigmatized about this. Okay,
You
so
know, I
yeah.
have people who were on my board and were diagnosed and decided not to speak up.
So they decided not to speak out, but they survived, did they?
They survived, but they don't want anybody to know they got it.
Okay.
So you have to respect their space.
Yes.
Because everybody also has to come to a point where they are comfortable enough to talk about it.
Yeah.
And that's where the mind also plays a role.
Yeah, you are doing a good job.
Those people. You can advocate, you can encourage, but you cannot push them.
Right.
So when people are comfortable and they're ready, you give them the platform to be able to speak and share their story.
Thank you, Miss Juliet. So, Dr. Bibi, how do we break the stigma in our society?
It's through advocacy.
She's bold. She's been able to speak out. She's been able to show her face. As she's saying, some of her colleagues or her friends were also diagnosed, and they don't want anybody to know. I mean, they want people to respect their privacy.
Yeah.
So, what can we do in our society here to break this stigma?
Talk about it more. Normalize conversations of breast cancer. Make it become like conversation about hypertension or diabetes. It happens in women. It's normal to have it. It's not like you are special or you are being punished for a sin you committed.
Right.
And that's is advocacy. Talk about it more, because our culture is such that we are told to keep quiet. We are not told to speak up. We're not taught to speak up.
Right.
So most people will prefer to be in a little corner and suffer in silence. But then we have to let them know that it's okay to speak up, like what she's doing.
Doctor?
Sometimes it is the voice we bring out that becomes the foundation, the hope upon which someone else will be able to get their own healing. The fact is, people tend to think it's private, but it doesn't affect only one person. It affects someone, it affects me. When it comes to stigma, sometimes people who have not yet gotten there, they begin to make all kinds of funny comments or the way they treat those who are victims. So they tend to shy away.
Okay.
But if you are either discriminating or treating them unfairly, you are just destroying a bridge upon which you might need to cross one day. It might be your mom, it might be your sister, it might be your auntie, your own wife, or someone else related to you. That is why we all have to come together. So to break the stigma, it's not just the job of those who are victims, but all of us in society, whether we are family members, whether we are victims, whether we are advocates, we have NGOs, healthcare professionals, everybody has a role to play.
So, Miss Juliet, your final words to this whole depression or mental health and then breast cancer. What are your final words on this?
I am certainly grateful for this platform because I think we need more platforms like this. But going forward, we just need to put action into, the discussions that we discuss. We need to make sure that we create a space for every sick person, whether it's breast cancer, whether it's other ailments, to have that psychological support. That it is something that is very, very important in the healing process of this, to make sure that the families also are educated and also have the support for the people who are going through the journey. So thank you. I think we just need to open the dialogue more and more and discuss more about the importance of the role mental health plays in all of the health care parts.
Dr. Bibi, you are a psychiatrist.
Yes, please.
How does depression and breast cancer, move along in general? And what are your final words?
Depression has been found to worsen the outcome of breast cancer. That's the link they have together. Because when you are depressed, you are not willing to do anything about the situation you are in. You are just in that sad state. And that's not seeking treatment worsens your prognosis. And my final words, in all this, we are talking about the patient who has been diagnosed getting depressed. But we should remember that the people around that patient also get depressed because they are seeing your loved one going through all these phases and you are helpless. So then we should also talk about that kind of depression when you're talking about breast cancer.
So, doctor, your final words?
So there is this mind-body interaction.
In 2 minutes.
The mind influences the body,
Okay.
and the body could also affect the way the mind works.
Okay.
Yes. So depression can even inhibit our immune system.
Okay.
And that's why it's important that we take good care of our mental health so that any chemotherapy or any other treatment we are going through will be able to work effectively. Okay. So let's not shut up. Let us speak up and be each other's keeper.
Thank you, Miss Juliet. Thank you, doctors, my lovely doctors, Dr. Anlima and Dr. Bibi. As they have always said, there is hope. Early detection saves life. So you don't have to be afraid. Even though there is depression or depressive symptoms in people who are diagnosed with breast cancer, if you get good support system, you are good to go. And so take advantage of this October and go check your breast at any public health hospital for free screening. When they come to your clinic, you do that for them, right?
Very well. For free.
For free. So take advantage. When if you have 1040, also you can do a mammogram as your birthday present. And don't be afraid. They have also told us that breast cancer is not for the poor, it's not for the rich. We are all at risk. If you are a woman with a breast, you are at risk. So take advantage of this October and do a self-examination. Go to the clinic for yourself, for your medical screening on your breast, and do a mammogram. I'm sure there are a lot of things that you may be hidden that the mammogram may show. I am your host, Dr. Sue, and I'll come your way again in the next episode. Stay tuned and bye.